Welcome everybody to the first health and biology, the first session of the URC this year. We have health and biology, and we're just going to get it started off right away with Jazmyne Sasse and her treatment and rehabilitation of hamstring injuries.
Alright, so as she said, treatment and rehabilitation of hamstring injuries. I'm Jazmyne. This is my PowerPoint. Ready, set, go. First of all, hamstring injuries are extremely prevalent. They account for about 29% of all sports-related injuries, and they tend to occur during non-contact activities. So these are things like sprinting, kicking, jumping. They don't come about because somebody's running into somebody. And what happens is that the muscle is pulled beyond its normal length. So it's the same thing as if you take a rubber band and you stretch it too far, not so far that it snaps, but far enough that when you let it go, it's just all flimsy and there's no elasticity left in it. That's the same thing that happens when you experience a hamstring strain. Your muscle is being stretched farther than it should be. And the problem is that there's a lack of effective rehabilitation. So doctors aren't able to prescribe a good method for patients to go through a recovery. And that's leading to a long recovery period of about 14 to 27 days. One of the other big issues is that there is a 34% reoccurrence rate, which is really high for any injury. And so one of the other things I looked at was how do we bring this rate down? So first, a little bit of anatomy. The hamstring muscle group is actually three muscles, not just one. It's made of the biceps femoris, which is this big one here, the semimembranosus over here, and the semitendinosus, which runs down the middle. All three of them insert up at the ischial tuberosity, which is where your hip joint is in the back of your leg, and they link the hip and the knee. Then they insert either the fibula or the tibia, depending on which muscle they are. Your hamstring is important for modulating hip flexion, which is lifting your hip up, so when you're in like a seated position, your hips are flexed, and knee extension, so straightening out your leg. It acts sort of as a brake to make sure these two joints don't go farther than they can. And what happens during the time when injury happens is during this phase right here, the terminal swing phase. And so what's happening is your hip is being flexed and your knee is being extended as you go to put your foot down on the ground. So the hamstring is in its lengthened state. And if an injury occurs, it means that the lengthening happened too much, or there was too much strain being put on the muscle when it happened. And the hamstring is stretched beyond its maximal length. So what happens is a patient reports to the doctor, says, I think I strained my hamstring, or I'm experiencing some pain. They normally report a sudden pain when it first happened, and there's often weakness, limited range of motion, and decreased flexibility in the affected side. Doctors will also look for what's called the stiff-legged gait, which means that the patient isn't bending their knee when they're walking because they're trying to keep the hamstring shortened rather than lengthening it and aggravating the injury. Sometimes the doctor will order an MRI or an ultrasound to get a better look at the injury, and they can really see exactly where the injury occurred and how severe it is, because hamstring strains are graded, so you can go from a grade 1 to a grade 3, with grade 3 being the most severe. When you do the MRI or the ultrasound, you can get a better view of how severe they are and then prescribe a recovery from there. So what my thesis focused on was what are the best treatment options? What treatment options are out there and how are they being used? And so I did a literature review examining what other people have suggested, and then I make a couple recommendations at the end. So I'm going to go through these ones and discuss a little bit about them. First off, there's traditional management, which is RICE, rest, ice, compression, elevation. It's like basic first aid for any injury. This is what you're going to do. The problem with this is it's leading to the high re-injury rates, and it's not predictable at all. So doctors aren't able to say, well, if you do this method, it'll probably be 7 days before you can return to activity. It just doesn't work that way with this method. So it's really an ineffective one, and one that doctors are starting to move away from. This stretching is one of the ones that I found is very, very important in recovering from a hamstring strain. If you stretch 4 times a day after experiencing a strain, your re-injury rate and your recovery time both decrease significantly. And it's important that you do stretching in a couple specific ways. One of them is called loaded lengthening. So this is called the Nordic hamstring stretch. And what's happening is you're leaning forward, so your hamstrings have to support your body weight as you're leaning forward, and they're also being lengthened as you're leaning. and that mimics the injury mechanism. And so your hamstring is not only being stretched, but it's also being strained. So there is weight being put on it. It has to do work in addition to just being stretched. And it mimics, again, that braking motion that exists when you're in the terminal swing phase of your gait. Dynamic stretching, as opposed to static stretching, is also really beneficial. So that's doing things like high knees or butt kicks, rather than just sitting on the ground and reaching as far as you can to touch your toes. That also is really beneficial. One of the debates that kind of goes on even amongst medical professionals still is, well, should I use heat or ice? And what I found is really that you can do either. Both have benefits. Both work to reduce the inflammatory response and reduce pain, which really is what you're looking for when you're using them. Ice tended to be more effective in the studies I read because it's better at alleviating the pain quickly and reducing the inflammatory response. However, heat also has its benefits. It's just not quite to the same extent that ice was. Generally, what people are recommending is use ice for the first couple days after the injury, and then after that, whichever one seems to help you more, stick with that because each person is different and each person responds a little bit differently. Anti-inflammatories are things that are NSAIDs. So these are like ibuprofen. You take them to reduce pain, reduce fever, and reduce inflammation. And if you take them within the first week of sustaining an injury, that leads to a faster recovery period because it's decreasing the inflammatory response and it's helping your body heal faster. One of the risks with anti-inflammatories is that they can cause mucosal damage in the lining of your stomach. As long as you always take them with food, though, that risk is barely noticeable. There are a couple new therapies that are out there. These are more biologically based. The first one is using platelet-rich plasma injections. So an injection that contains platelets and growth factors is injected to the site of injury, and then that helps with the tissue regeneration, and it's been shown to decrease return to play by about 3 days. This is still kind of in the works, so it's not one that's readily available yet. The other one that I looked at was using stem cell injections. So these are muscle-derived stem cells. They're injected and then they help increase the muscle strength and grow back the muscle that was damaged. Surgery is rare for hamstring strains, but it does happen. Most of the cases when surgery is used is when there's total avulsions, so the muscle is torn completely. And they have no other choice but to go in and surgically put the muscle back together. And so what happens is they put a couple sutures in, and they form what's called a gliding stitch. So it essentially links the muscles together, but doesn't glue them together, so they can heal back together on their own. And then patients will progress through physical therapy as able. So I'm sure you're sitting here thinking, well, that's great now, but I don't currently have a hamstring strain. What do I do to not get one? And really, prevention is the best thing you can do because there are such high re-injury rates that if you avoid getting one in the first place, you're less likely to ever get another one. One of the things they think is contributing to the high re-injury rates is the buildup of scar tissue. In the first year that scar tissue is building up, it's weak. By the time you hit that 1 year month, then it gets stronger, or that 1 year mark, it gets stronger and stronger. But up until then, it's weak and it's likely that you get another injury there. Another possibility is that you're returning to activity too early. People just don't want to wait until they heal, and then they get hurt even worse. Another thing you can do to prevent is stretching, and like I said before, dynamic stretching is very important. And it's also good to keep in mind that you should increase flexibility in all muscles, not just the hamstring, because it's better to have overall flexibility. And then strengthening, making sure your hamstring muscle is strong enough to lift whatever load you're going to be doing. And they recommend at least 60% of your 1 rep maximum is what you should be doing for each rep, and doing eccentric and multi-joint strengthening exercises. So in conclusion, what did I find? What really is the best way to do this? First of all, prevention. Don't get one, you're not going to have another one. End of story, right? All right, too bad you got a hamstring strain, now what do I do? Combination of multiple techniques. Take NSAIDs within the first week, reduce inflammation. Ice it within the first week, reduce inflammation, reduce pain. After that, heat or ice, whichever one works better. And stretching. Stretch up to 4 times a day, as far as you can, as much as you can, to reduce the damage that was done to your hamstring. and then progress through these steps as able. There is no, on day 3 do this, on day 4 do this, on day 5 do this. It's as your body is able, go through these steps. Then there are some of my references I use. And at this time, are there any questions? Yeah, go ahead.
About 2 years I actually had a hamstring injury, and my injured leg actually was shorter than like my normal leg. Did you find anything about that during your research?
There was nothing specifically about that, but it was shorter prior to the injury, right? Or
Yes,
after?
After the injury,
Yeah.
my injured leg was shorter.
Yeah, that's not totally surprising to me because when it heals, the muscle isn't going to heal back exactly the way it was before. So it's not surprising that something would happen while it was healing that makes it a different structure, and that led to shortening a little bit. Mm-hmm. Yeah.
So for, like, when you're talking about like, the plasma and everything you're introducing, is that used commonly, or is it more for just like the athletes, where they like the highly paid athletes who
Right.
want them back on the field?
It's the people who can afford it, first of all, and then the people who need it most. It's kind of where they're looking at doing that. Now, what might happen is it may become more commonplace, but as of right now, yeah, it's the highly paid athletes who are getting that done. Any other questions?